The following show is for educational purposes only. It is not intended to diagnose nor treat any medical condition. Any information or recommendations provided should always be discussed with your healthcare professional. Welcome to the Patient Talks. I'm Physician Assistant Frank Smith. On this week's episode, we're going to be discussing the pain in your butt. No, not your spouse, not your job, or even your kids. We're discussing Sciatica and Piriformis Syndrome. Sciatica and Piriformis Syndrome make up what's called sciatic neuritis, meaning irritation of the sciatic nerve. And it can have very similar presenting symptoms, but a very different underlying cause. We're going to cover both of them today. We're going to discuss some of the basic anatomy and some of the things you can do to help treat it at home and some of the treatment options we have available to you. Let's start with some very basic anatomy. So your spine is made up of individual vertebrae that are stacked like poker chips. In between each vertebrae, there is one pair of nerves that comes off to send information to different parts of the body. Down at the bottom, there's several of those nerves that come together to form what's known as the sciatic nerve. The sciatic nerve tracks along your butt, into the back of your thigh. It starts to make a turn at the outside of your knee, comes down to the outside of your lower leg and the top of your foot. That is the distribution of the sciatic nerve. On any nerve, when it becomes irritated or inflamed, it lets you know about it. In sciatica, there's a couple of different things that can produce this. We're going to start first with kind of the more simple and easier one to treat, and that's Piriformis Syndrome. Everyone knows that the big muscle in your butt is the gluteus maximus, right? However, deep up under it, there is a triangular shaped muscle called the piriformis muscle. The sciatic nerve, after it comes from the sacral area and starts down into your butt, runs right past the piriformis muscle. And if that muscle has become irritated and inflamed or spasmed out, it will swell and it puts pressure on that sciatic nerve. And the sciatic nerve will promptly let you know about it. And so you end up with a pretty severe pain in your butt. Sometimes it does radiate down into the thigh and can even go all the way down into your lower leg. But typically, most of the presentation is this deep, painful ache down in the top of your butt. Home treatment for Piriformis Syndrome starts with stretches. There are multiple reputable websites that will give you good information on how to stretch that piriformis muscle. Heat to the area and massage is well worth doing as well. And about 30 to 40% of the time, that home treatment is really all you need. However, there are some patients that it doesn't seem to respond to what they do at home and they come to their clinician. We do have some options as well, as including what's called a trigger point injection. And that's where we put a volume of fluid right into that piriformis muscle to help make those fibers lengthen back out and calm the spasm down. Physical therapy also is very beneficial in Piriformis Syndrome. If it's still not responding to those, there are medications that we can use as well. But Piriformis Syndrome is one of the more common presenting complaints of sciatic pain. Next up, we're going to cover true sciatica. In true sciatica, the pain can initially start very similar to Piriformis Syndrome, but it won't really respond as well to the piriformis stretches and some of the other things that we had talked about. At which point, usually imaging is ordered by your clinician. And the most common cause of true sciatica, unfortunately, is a herniated disc in the lower spine. Now, what that is, like I mentioned before, the vertebrae are stacked like poker chips to make up your spine. In between each individual vertebrae, there's a little cushion essentially between the two. And what can happen over time is that disc can start to herniate or bulge out, and it will put pressure on some of the nerves that end up making the sciatic nerve. And so you end up with pain along that sciatic distribution. Now, true sciatica can cause some bigger problems than piriformis syndrome. And the reason being is we're at the root of the nerve. So it's not just a sensory nerve, but we can also get some motor involvement as well. And what that means in English is you may start noticing that your gait is changing. Your foot may start to drop when you start to walk. If you see any of those symptoms, it is imperative that you get into your clinician pretty quickly. As far as treatment for sciatica, it depends on the severity. If it's relatively mild, weight loss, physical therapy, and even some of the stretches we had talked about may be beneficial. If it's not responding to that, but we're not at the point of surgical correction, there are medications that we have on board that can help calm down that nerve so that you have less pain. If your symptoms are severe, your clinician may talk to you about surgical correction, because ultimately what we have got to do is get the pressure off that nerve. And there's the basics of the pain in your butt, sciatica and piriformis syndrome. I hope you've enjoyed the show. I hope it's been informative. If either one of those is true, please click the like and subscribe button. I'll be back next week. Until then, you better make me look good. See you soon.